So now folks, we're going to look at everybody's first aid training day favourites, major bleeding, wounds and bleeding. The first thing that we need to consider is our risk assessment. Some people are quite squeamish when it comes to dealing with blood. And because you've got a first aid piece of paper that says you are now qualified, that doesn't necessarily take that away. So the first thing is actually assessing, are you the person best placed to deal with this injury? Now think about this. We can run in with the best of intentions, but if we go dizzy and faint and become unwell ourselves, then we haven't been able to help that casualty. Nobody's called an ambulance, and whoever now turns up has got 2 casualties to deal with. Something you probably didn't expect to hear on this first aid course is it is perfectly acceptable as a first aider to delegate and tell somebody else what to do. Best practice, if you've decided that you are in a position to help this casualty, we want to try not to touch a bleeding casualty without at least 1 pair of latex-free gloves. If these aren't instantly available to you, make a dynamic or risk assessment at the time, improvise. Please make sure that you wash your hands for a minimum of 5 minutes afterwards with plenty of hot, soapy water. So there's just a few simple things that we can do to minimise the damage for a casualty who is majorly bleeding. Maybe this is a kitchen accident, perhaps it's an attack, maybe it's a self-harm, perhaps it's happened in the workplace, but the premise is exactly the same. The first thing I want to do is I want to apply direct pressure to the wound. And I can use a visual aid here. My casualty may be panicking, there may be a language barrier, they may not be able to understand what I say, so I can use that, put some pressure here, visual aid. Or I may need to do this myself. After I've applied direct pressure, I want to elevate the injured part above the level of the heart. Injured part above the heart. This is going to slow down the blood flow to the wound and slowly drain it back down to the vital organs where it's actually required. Now what I need to give some consideration to is that at some stage my casualty may go into shock. In this case, hypovolemic shock. A fancy way of saying they've bled too much. My casualty who's going into shock is going to look pale. They're going to have a weak and shallow pulse. As a result of that, their breathing is going to be quite raspy, they're going to be quite sweaty, disorientated, panic, and may fall to the floor. This is because when the brain realises it's losing oxygen, it starts to panic. And what it's going to do is it's going to command the remaining blood up to it to keep itself fed and keep itself alive. So one of the first things to go are the legs. That's the brain powering down the body to preserve itself. So I want to get my casualty down as safely as I can onto the floor. Pressure, elevation, casualty positioning, keep them down low. What I want to do at this point is have a very quick look at that wound. Is there a piece of information that I can pass over to the paramedic or to the operator about that wound? How does it look? What may have caused this? Is there something that might be useful to whoever's going to take over? Major bleeds is something I definitely want the emergency services to come out and take a look at because there could be other considerations and complications that may follow. What I want to do until those services arrive is apply a bandage if I have a bandage, but please understand that a t-shirt, a headscarf, a towel, an item of clothing, flip chart paper, if that's all that's available to you, is just as effective. All it has to be is an effective barrier to try to slow down the blood loss significantly until further help arrives. If there's something sticking out of the wound, don't try to remove it. It could cause them to bleed more, it could cause further injury. I want to keep the pressure on, I want to keep it elevated, and I want to keep my makeshift dressing available. If I happen to have a bandage or my wound is not quite major, then of course I can source my first aid kit, I can get my bandage. What I would like to do if possible is offer the short piece of bandage to my casualty to hold. This keeps them engaged, gives them a job to do. And with the pad, I want to try to place that as over the wound site as I can. And a little rhyme to help you remember, with the roll, keep control. I'm going to unwind around my wound rather than just let go of the bandage. As soon as it arrives and it's gone over the floor, it's technically spoiled. Offer them the short bits, the pad over the centre, and with the roll, keep control. And I'm going to tie that off. If blood continues to come through that dressing, I'm going to apply another dressing. If blood continues to come through that dressing, I'm going to apply another dressing, and so on. I don't want to give my casualty anything to eat or drink. I want to monitor their alertness, and I want to keep reassuring them until medical help arrives.